Hi, welcome back to my channel. It's Dr. Erica. Thank you for joining me. I am talking about a few topics that are worth mentioning due to the news, due to some news updates, things that are happening concerning medications and drug use in our society. So I thought I'd come on today to give some updated information, informative information, educational information that you can use to help your own livelihood, your own community, your own local community. So I'm Dr. Erica Onigbola, pharmacist for 13 years now, and I am licensed, registered. I am in my 13th year. My platform on YouTube, main channel, Erica Onigbola PharmD. This is a secondary channel. Please stay to the end of the video. I want to talk about the recent death concerning one of the local, I guess, Atlanta rappers, and the son was found drowned in the local lake or body of water. And according to the autopsy, there was use of a hallucinogenic substance, or magic mushroom is what it's called, and it was consumed. And so the young man consumed this item and then was later found drowned. So the cause of death was due to drowning after consuming the magic mushroom, hallucinogenic. And it is originally a Scheduled 1 classification according to the FDA and DEA, and I did some small research with the John Hopkins reading, and they, just looking back on some details about magic mushroom, it is again a Schedule 1 or Class 1, which means that any substance found under Class 1 has no medical benefit, no medical regulation, or no medical use. And because of that, pretty much illegal to use. So, again, Schedule 1 classification means don't use it. Psychological dependence, um, it's harmful, it's not readily study to be considered for medical benefit. So stay away from use of any Schedule 1. Cocaine is also in that Schedule 1. Crack cocaine, marijuana in most states have, oh, well, recently Trump has now reclassified marijuana to Schedule, I want to say 3 or 4, but before then it was Schedule 1. So anything in the Schedule 1 class, like the crack cocaine or the magic mushroom, should not be used. Also, magic mushroom is studying or being studied by John Hopkins for major depression and anxiety, especially with those who are looking to quit smoking, or those young individuals who are having a depressive mode or dealing with major depression. Research has found out in a double blinded study, that means that all subjects are not aware of what they're actually taking. Have these double blinded studies have been performed, and then the results were that the magic mushroom being taken twice a day did relieve depression from 6 months all the way up to a year's use. So there may be some potential later on once we learn more. Maybe more research needs to be done, maybe more analyzing data needs to be done of the research that's already taken place. Maybe some marketing, maybe some um, more trials needs to be run before this magic mushroom can be approved for use outside of the Schedule 1 classification. So maybe that's something that our current president administration can look into. And there has been billions, millions that have been spent on this research. However, at the current time, there is no medical use, um, legal medical use, to be taken twice a day for depression or for anxiety. It works according to um, the John Hopkins that has done the research and have presented it on their website. It works to help coordinate or help to relax agitation and anxiety, helps, I guess, individuals to focus better. But when it's taken illegally, the outcome is that there are no multitasking abilities, there's no coherent understanding of what is actually what the person is actually going through or what they're doing. They're not able to do their task. They're not able to actually perform very well under their own, discretion outside of a physician's prescribing and monitoring. So I mean, my thoughts as a pharmacist would be to hold off until the research has run its course, until all the trials have been actually approved, a patent has been performed, and the FDA has had this medication reclassified to a Schedule 2 or Schedule 5 even. So I wouldn't encourage use outside. I know people do what they want to do. People do things, that suits them for the moment that they may be dealing with something. However, if you are a recovering or you're someone who wants to do better and or just wants to, look more into magic mushroom, I would just say wait until the research trial has revealed such. So that's my thought on that, and my condolences to the family who have lost that young man due to the drowning. Um, there was no foul play; it was just him drowning, and there was the autopsy show that there was this product in his system. So, um, moving on to the next topic, I wanted to mention that um, there's there's a lot that's going on in the news. A lot is going on. I try to keep up as much as possible, just because I want to know, you know, want to know about the health and well-being of people. And this start of 2026 has not been so positive. It's been all over the place. Um, Cancer diagnosis with um, one of the Real Housewives and her kidney her kidney um, failure diagnosis. Then um, there's recent deaths about cancer. There's recent deaths about opioid abuse and overuse. Um, Parkinson's disease, ALS, um, terminal illnesses that have no cure in sight, HIV diagnoses, and um, measles outbreak. Although there's vaccinations that I have even administered myself in the community pharmacy working. There's the measles outbreak, there's the RSV outbreak. So, um, and then the shingles is very prevalent too. Shingles is very prevalent as well. There's vaccinations for that. Um, cdc.gov has all of the immunization vaccination recommendations. So if you're someone who needs to be updated, talk with your pharmacist. Check out the cdc.gov website as well, and that will help too. So to keep you informed about what you should take next and the time frame at which you should take the particular vaccination. So I hope this information has been informative to you, and please do your research on everything. Go to reputable um, informative websites, and that includes again cdc.gov and the FDA website, and also DEA, and research as well. John Hopkins, St. Jude's, a lot of charity charitable places as well that are treating diagnoses. So terminally ill diagnosis. So it's good to be informed, and I hope that you are having a blessed day and that you're positive and you're dealing from a biblical standpoint, and you are healthy and well, and all things are working for the best for our families and loved ones out there. So thank you for joining me. I'm signing off. This is Dr. Erica. I hope to see you on the next video. Take care. Bye bye.